This is the critique for the system assessment 2 of the HENT. So this one was a little bit harder to do and to remember just because it had so many steps involved in it. Again, it was hard to get the full picture in the camera of me examining the patient. In the first section of it, I forgot to examine the patient's neck and see if he had any scars or the color, like any discoloration or anything of it. I forgot to check the cervical and to see if he could like move his neck correctly, which of course in the video you could see that he could move his neck correctly, but I didn't know that prior to starting the exam, so I should have asked him to do a full range of motion of the neck just to see if he had any issues with that. And then going on to the eyes, I didn't have a Snellen eye chart on me. I probably should have printed one off online or something just to do it, but I did miss that step of the exam. I forgot to mention if he had any edema or discoloration of the eyelids, which I did check his eyelids and his eyelashes, and there was nothing abnormal with them. The ophthalmoscope is very difficult to get a good hold of or to know how to use, especially if you haven't had any prior use with it. So I definitely need more practice with that, and I did notice that my patient was complaining of like the light being in his eyes because I was holding it for so long trying to see in his eyes and what I was trying to look for, and it was just difficult on his eyes. During the exam, looking back at it, I did notice that I was kind of all over the place. It wasn't like a smooth flow of the exam just because there were so many steps that I would catch myself going back because I would forget to do something. When I did do the ophthalmology exam of the eyes with the scope, I shouldn't have had him put his head all the way back. I should have had him keep his head straight so I could have looked directly on or into his eyes with the light. The whisper test, the patient was worse in the right ear because he did have reconstructive ear surgery when he was younger, so he kind of has his hearing in his right ear is a little bit worse than the left from that. I didn't have any gauze when it came to the palpation of the tongue. So I didn't do that step. I didn't have any gauze, and I don't have a tongue blade, which I should probably get one. I don't have any popsicle sticks either, but so I couldn't do that. And I think that was it for this one that I noticed.